Hi, Mary. I'm Kathleen. I'm going to be your CNA today. The nurse asked me to provide foot care for you, okay? I'm going to get the equipment and we'll get started. Now, one of the things you want to make sure of is you recognize the equipment that you need for this skill. Notice that I have a basin of water, washcloth, 2 towels, and I'll explain why in a moment, your soap, your lotion, and gloves. Now we're going to provide privacy before we start. One of the things I want you to remember, when you're doing this skill, you can do it with them sitting on the side of the bed, or you can do it with them actually in the bed. We're going to do it with her on the side of the bed, okay? So the first thing we're going to do is have Mary sit on the side of the bed. Mary, if you would, get ready to sit on the side of the bed for me. And what I'm going to do is place a towel down here, because you're going to be able to place your foot here, and I'm going to also place a basin here. One of the things you want to remember for infection control, you never ever want to place a basin just flat on the floor. You want to make sure you have a barrier. Now, I've already tested the water to make sure that it's comfortable, but you also want to ask your resident or your patient to check it too, because remember, you're providing this care for them, so this water temperature needs to be right for them. If you would, just test that and let me know if it's okay. That's okay? All right. We're going to sit it down here, and if you would, just place this foot in the water for me. All the way down if you can. All right, you okay? Now, prior to washing, you want to always make sure, of course, you put your gloves on. So we're going to go ahead and put our gloves on to wash our foot. And just a big tip with water. Anytime you have water, you know you're going to need gloves. Okay? So we're going to just bring these around here so it's a little closer to us. So now I'm going to actually start to wash her foot. Foot care is very important for our patients, so you want to make sure that you do that on a daily basis and really do a good job at it. I'm going to apply some soap to the washcloth. Notice that I'm not putting soap in the water, okay? So I'm going to have her lift her foot up. And you're just going to wash her foot. You want to make sure you wash her foot really well, all over. One of the things you want to make sure of is that you wash in between their toes. That's very important. Okay? Make sure you wash all over. You have her place her foot back in the water, because you want to rinse her foot off really good. If you'll lift your foot up just a little bit for me, Mary, I'm going to make sure we rinse it really well. Again, don't just rinse the foot. You want to make sure you rinse in between the toes really well. Foot washing is extremely important, especially for our diabetic patients. Giving them good care is just very, very important. You can place your foot right there. Now what you're going to do is you're going to dry her foot. What I'm going to do is just kind of move this water out the way so I can really dry her foot really good. If you lift your foot up for me, thank you. Remember, on test day, if they can assist you in any way, you ask them to. You want to pat dry the skin. Anytime you're drying off the skin, pat dry. You never want to rub the skin because, again, remember, the skin is extremely sensitive, especially when they're sick. Make sure you dry in between the toes. Can't do half a step. You must do the entire step. Now what we're going to do is apply some lotion. And you want to kind of rub it between your hands first. Lotion can be a little cool. You want to put it on her foot, top and bottom. Notice that I'm not going in between her toes with that. The skin doesn't like moisture. Moisture causes the skin to break down, so you don't want to leave any moisture on the skin if you can avoid that. Once you've rubbed it in really well, you want to take your towel and kind of blot dry a little bit more just to make sure you're getting off any excess lotion. Okay? All right. You want your sock back on? Sure. Okay. We'll put that back on for you. Just turn it the right way. Once you've done that, foot care is now complete. What I'm going to have her do is just go ahead and lay back on the bed for me. Okay? And we're going to just pull this up. Now what I'm going to do is go over to the sink to get rid of all of my supplies. Okay? So at this time, I'll be going over to the sink to actually empty, rinse, and dry the basin. So if you'll follow me there. Now remember, you gotta You must empty, rinse, and dry. So we're going to empty it out. You're going to rinse your basin out. Remember now, you can't do half a step. You have to do the entire step to get credit. You're going to get your paper towel and dry your basin out. Once you've done that, then you're going to place this on your designated dirty supply area. Okay? Now we're ready to go back and get rid of our linen and dispose of it properly. So now we're going to get rid of our linen. Okay? Once you've done that, as far as getting rid of your linen, now it's time to take off your gloves. So you want to remove your gloves. Throw them away. At this point, you would say, I'd wash my hands. Of course, in reality, remember, you would actually wash your hands. But for testing, you can just say, I'd wash my hands. All right, Mary, we're all done. Here's your call signal, okay? You just call us if you need us, okay? Skill is now complete.